What type of surgery uses an extremely cold probe to freeze and kill abnormal cells? Cryosurgery. Cryo, jamun's ice cold, frost. What does a modifier do for a diagnosis code? ICD-10 code? A modifier makes it more specific. The more numbers in a DX code, the more specific it is. What does a modifier do for a CPT code? The modifier adds more information about the procedure, like any special or unusual circumstances. What is the first thing you should do if a patient faints? Place the patient in a supine position with the feet elevated. Then apply a cold compress to their forehead and check vital signs. A patient has a coinsurance of 90/10 and his visit comes to $300. How much does the patient owe? $30. Patient is responsible for 10%. What is the allowed amount? It is the most a health plan will pay for a service. What does epinephrine do when used with a local anesthetic? Epinephrine is a vasoconstrictor that helps reduce bleeding and prolongs the effects of the anesthesia. When preparing a patient for a rectal exam, which position should they be placed in? The most common is Sims position. It can also be knee chest. Which position is used for the pelvic exam? Lithotomy. What is the process of destroying all forms of microbial life? Sterilization. True or false? If a patient is crying, you should assure them that there is no reason to cry because everything will be okay. False. You should never give unwarranted assurance. Allow the patient to cry. In what part of the ICD-10 should an assistant begin when looking up a diagnosis code? Volume 2. The alphabetic index, true or false? A heart rate of 140 is normal for a 6-year-old child. False. A normal pulse range is 70 and 130 for a 6-year-old. True or false? A respiration rate of 22 is normal for a 6-year-old child. True. The normal respiration rate for a 6-year-old is 1830. True or false? HSV-1 causes cold sores. True. HSV-1, herpes simplex virus type 1, causes cold sores. What does CPR stand for? Cardiopulmonary resuscitation. What does the abbreviation PRN mean? As needed. What does the abbreviation AC mean? Before meals. What does the abbreviation PC mean? After meals. What does the abbreviation HS mean? At bedtime. What is the OSHA form? 301 used for? To report incidents such as work-related injuries or illness. What is the quality control log? Used to document the results of control testing, which ensures quality results of equipment and testing materials. What is the CMS 1500? The Universal Claim Form. It doesn't have pre-printed codes. An encounter form is used to fill it out. Flammable liquids classification. Class A extinguishers contain water and should not be used on flammable liquids. Class B extinguishers contain carbon dioxide and can be used on flammable liquids such as grease. Class C extinguishers contain a dry chemical for use on electrical fires. Class D extinguishers are used on combustible metals. Vitamin B deficiencies. Vitamin B6, cracks around the mouth, rash, depression. Vitamin B3, digestive issues. Vitamin B1 on heart failure, nervous disorders. Vitamin B12, pernicious anemia, state of confusion. The superbill, or encounter form, is used to fill out a claim form accurately. It is also a form with pre-printed diagnosis and CPT codes. The provider also uses the encounter form to indicate when he, she, wants to see the PT again, not the same as the return visit date. What is the normal range for hematocrit levels? 1. For male patients, it is 42 to 52%. 2. For female patients, it is 36 to 45%. What is the normal range for hemoglobin levels? 1. For male patients, it is 15 to 17 GDL. 2. For female patients, it is 12 to 16 GDL.